Hi everyone, welcome back. So today I'm going to be continuing my sort of series of videos talking about women's health issues. I am actually talking today about endometriosis, which is probably a topic close to my heart because I suffered with it for years. And also, I've treated quite a few clients fairly recently with endometriosis, and quite often people think, well, if I've got endometriosis, I can't have a massage, and because there's all these sort of factors, it could be embarrassing for me if I bleed, or it'd be painful, or whatever. But also, I've dealt with this condition a lot, both as a gynae nurse and as a midwife. And as I say, I was sort of one of many to suffer with it myself. Initially, as with a lot of women, it went undiagnosed. Initially being sort of diagnosed as pelvic inflammatory disease. Then they thought maybe it was polycystic ovaries, and it was a long road, and I pretty much tried every treatment available, but eventually I had a hysterectomy at 34, because we tried everything else. But yeah, I mean, it was very, very difficult condition to live with, and something that I think people can only really understand the extent of how debilitating it is, when they've had it. But hopefully the information I give today may be of some help. Certainly, being a massage therapist, I've said it before, I find it very difficult to understand why so many therapists do not treat the abdomen, because it can benefit so many conditions, including endometriosis, IBS, and various other pelvic conditions. You just have to go to someone who's qualified and experienced. I'm not going to claim that massage is like this miracle cure, but it can certainly allow women to be just more functional in their daily life, allow them maybe to go back to work, or to potentially delay the need, for surgery, which, obviously is always a sort of a last option. So yeah, as I say, I suffered with this condition for years, and after initially being misdiagnosed and having numerous laparoscopic surgeries, being told that I'd never have children, suffering miscarriages, I finally got an answer. For me, I would bleed, sort of in the last few years, certainly I would bleed for 32 days straight, and the pain would be so bad that at times I couldn't even feel my legs. I suffered chronic fatigue. Sex was just, you didn't even really want to think about that. As anyone with endometriosis knows, you don't dare to wear anything white, or even light colours, because even if you're not bleeding on a given day, you always have the fear of being, stood in the queue at the supermarket and then suddenly flooding. Because as any of you who suffer with this will know, sometimes there is no warning. Now, I never actually had the desciolysis surgery, but I had numerous laparoscopies, endometrial ablation, which burns away the lining of the uterus. I had various medications, ranging from the tranexamic acid to Zoladex injections, to effectively chemically induce the menopause. But that was only licensed for 6 months. I had an IUD coil fitted, which my body didn't like at all and promptly spat back out. And finally a hysterectomy. Many people go through worse, including numerous adesiolisis surgeries, which actually often are a short-term solution, and can promote, that cycle of pain and scar tissue. So they're not always, particularly beneficial. This condition is not, as many people still think, just a case of a heavy period. It is a debilitating condition. Apologies if you can hear my neighbour's dog barking in the background. So in this video, I'm going to explain how massage can benefit. So firstly, I'm going to talk a little bit about endometriosis and exactly what it is. So it's, it is one of the prevalent conditions affecting quality of life during childbearing age, with 89 million women of reproductive ages and an estimated 2 million women just in the UK suffering with endometriosis. But, the true extent is actually unknown, because this is so, it takes so long for women to be diagnosed with this. And quite often it is just seen as, oh, you've got heavy periods or whatever. So there's probably actually more than that 2 million, suffering in silence. So it is rare, in peri or postmenopausal women, but it does happen. But it isn't particularly common. Endometriosis can cause numerous symptoms, which I will talk about, but certainly severe pain, painful sex, abnormal bleeding, painful periods, and certainly decreased fertility. It can absolutely negatively affect the ability to work, the ability to have relationships, and these things can really reduce a woman's self-confidence. And as we said, the difficulty is that so often this condition is misdiagnosed as other conditions causing pelvic pain, things like pelvic inflammatory disease, which is quite often tends to be one of those sort of vague terms that is used when there's, no one can come up with a specific diagnosis. Ovarian cysts, irritable bowel syndrome, and certainly, as I can confirm, with my own case, IBS has been linked to endometriosis. So what is endometriosis? Okay, diagram time. So basically, this would be your normal womb, okay, and you've got a lining here, which every time you have your period will shed and come out. So with endometriosis, you get endometrial hyperplasia. So the endometrium is that lining, that inner lining of the womb, and you get excessive thickening, which you can see here, and then consequently excessive shedding of this lining of the uterus. And so these endometrial cells can also then grow elsewhere in the body. So maybe in the fallopian tubes, in the ovaries, and the omentum, around the bowel and the bladder and the vagina. And in severe cases, endometriotic tissue can migrate even up as far as the lungs, the eyes, and even the brain. And certainly, there have been cases where, when it's, quite bad cases, where women can also sort of suffer nosebleeds and headaches and all sorts of things like that. So during, the monthly cycle, obviously changes in the cells occur as they, would in the uterus in preparation for ovulation. But if the egg isn't fertilized, then the cells, those endometrial cells that we've just seen on the diagram, they break down and bleed, and hence you get your period. Now, the uterus has an exit route for this bleeding. But obviously, if you have endometrial cells growing in other parts of the body, maybe on the bowel or, wherever it may be, these areas don't have an exit route. And so that's, when you then get a lot of internal bleeding, pain, inflammation, and you get a lot of scar tissue formation from these endometriotic lesions. And what this then does, the scar tissue then pulls on other tissues internally, which then promotes the pain cycle. And that's where you get your adhesions, and hence the adhesiolysis surgery to separate these adhesions and prevent organs from sticking together. Also bleeding, from endometriotic cells that develop in the ovaries may also form cysts, which can cause severe ovulation pain. And aside from sort of the obvious physical symptoms, chronic fatigue, feelings of isolation and depression, will seriously impact on relationships. And also, the fibrous adhesions, we talked a little bit there about adhesiolysis. Fibrous adhesions form to help the body heal as part of the, inflammatory process. These adhesions, they help the body to kind of heal itself, but in the process, they cause tissues to stick together. Which can then cause lifelong issues, even when you have the adhesiolysis surgery to divide these adhesions up and free the pain a little bit, you're then causing more scar tissue. And so the potential for it to happen again, unfortunately is quite high. And, as we know, endometriosis can absolutely cause fertility problems as well. So what are the causes of endometriosis? Well, it's not completely understood, but there certainly are some suggested theories on what causes it. Probably the most common one is something called retrograde menstruation. The theory on this is that blood containing those endometrial cells doesn't actually leave the body during a period. But instead what happens is, I don't know how clear that is, it's probably not very clear. So basically you've got the uterus here, and then you've got the fallopian tube that runs up here. So the idea is, with retrograde menstruation, the endometrial cells in the uterus here, some of it flows back up through the fallopian tube, okay, and it causes cells to stick to the pelvic walls and organs, where they continue to grow and thicken and bleed over the course of each subsequent period. Another theory is something called the induction theory, where hormones or immune factors promote transformation of peritoneal cells, which line the inner abdomen, transform them into endometrial-like cells. Another theory is embryonic cell transformation, which is that hormones may transform embryonic cells into endometrial-like cells during puberty. So before you've even had, or around the time that you have your first period, this could be happening. Another cause could be surgical scar implantation. So once you've had a surgery, for example, if you've had a C-section, or even a hysterectomy, endometrial cells may potentially attach to a surgical incision, and then obviously grow. Another theory is endometrial cell transport, where blood vessels or lymph fluid may transport endometrial cells to other parts of the body. And also immune system disorders, which may inhibit the body's ability to recognise and destroy endometrial-like tissue that's growing outside the uterus. So there's a few potential causes. So who are at risk of developing endometriosis? So risk factors include people who have never given birth. And certainly I would say it's more common to, those women that develop endometriosis, by the time they get diagnosed, they can usually trace it back, to their teens or early 20s, before they've had children. Other risk factors are, menstruating from an early age. And certainly we know, a lot of girls now are starting their periods earlier than they used to. But also menopause at an older age. So, if you're sort of the length of time that you're having periods is extended. Short menstrual cycles. So if we're talking cycles that are less than 27 days, heavy periods that last longer than 7 days, high levels of estrogen in the body, a low body mass index, though I have to say that was never my problem. There probably is a genetic link. If one or more relatives have had endometriosis, you're certainly more likely to have it. Any medical condition that prevents, the normal passage of menstrual flow out of the body, or any, abnormalities of the reproductive tract can all, increase your risk of developing endometriosis. So what are the complications of this condition? Well, we've said infertility and reduced fertility, and also impaired implantation. So approximately 33 to 50% of women with endometriosis will have difficulty in getting pregnant. And this is often due to the fallopian tubes being obstructed, which, then prevents insemination, or potentially that the egg, is damaged. Since the condition tends to become progressively worse, it's advised where possible to try to conceive early, which of course isn't always practical, but, in an ideal world. And it is possible that laser removal of endometriotic tissue may improve the chances of conceiving. Now, this is not the same thing as endometrial ablation, which actually kind of burns away the lining of the womb, and it's suggested to only have that if you're not looking at having, children. Another complication is a higher incidence of ovarian cancer, although the overall risk of ovarian cancer is still relatively low. And also, and this is rare, is endometriosis-associated adenocarcinoma, which can develop later in life, but, as I say, it's rare. So, what are the symptoms of endometriosis? Probably the most highly recognised symptoms are the pain and the bleeding. So the pain can be unbearable, persistent pelvic pain, which extends into the abdomen, into the back, sometimes into the legs. And this is in addition to the usual menstrual cramps that you can get. And this pain can increase over time. Obviously painful periods, and the pain may extend outside the days of bleeding. Also, quite often pain either during or after sex. You may have pain with bowel movements, or even urination, especially during a period. Excessive bleeding, heavy periods, and commonly flooding, and even bleeding between periods, and certainly a lot of you that suffer with this, you may well get to the point where you don't even recognize when your periods are, because the pattern is just so, all over the place, or the bleeding periods are so extended, that it's difficult to actually identify, when your periods are. As we've said, infertility, chronic fatigue, diarrhea, constipation, rectal bleeding, bloating, nausea, particularly again during periods. And as we said, IBS has been linked with endometriosis also, which is also going to give you some of these symptoms. Certainly, as we said, pain can extend into the up thighs and around the groin. Sometimes, as certainly I found, numbness in the legs. And also in rare cases, as I said, you can get like nosebleeds with endometriosis, and in rare cases where endometriotic tissue develops in the lung, it's possible to, even cough up blood. So how do we treat this condition? There's a few sort of ways you can approach treatment. The treatment obviously aims to reduce the symptoms, to improve fertility and prevent the progression of the condition. But the form of treatment really is dependent on the severity of the symptoms, of your age, and whether you want to conceive. Surgery may remove endometriotic tissue and provide relief for years, but it also increases the risk of scar tissue, and the endometriotic cells will often grow back. So you really have to, examine your options very carefully. So, surgical intervention, there are various stages here, and some of them are really last minute, sort of last options. Obviously, with any surgical treatment, you've got the risk of the anaesthetic, infection, bleeding, scar tissue. But certainly a laparoscopy may be needed to confirm the diagnosis of endometriosis. And this will show clearly, the endometriotic lesions, which can fall into three categories. So you have your endometriomas, which affects the ovaries, superficial lesions, and you have deep infiltrating endometriomas. So if you can see on this diagram, so you've got the bladder here, you've got the bowel, large intestine coming round. Now you've got, let me just get this right, yep. Okay, so you've got the uterus here, and then we are, fallopian tube going round into the ovary. So you can see these black areas would be endometriomas, okay? They would be these areas of endometrial tissue that have migrated through whatever reason, and started to grow on different areas of the body. Now, these peritoneal lesions may look red, brown, blue, black, or even white and scar-like. Certainly in more severe endometriosis, they tend to be blue and black. And patches of this tissue can be surgically removed in order to improve the symptoms and also improve fertility. So that's your laparoscopy. Then we've got adhesiolisis surgery, which basically divides those internal adhesions, where the organs get stuck to each other and then causes pain. But the problem with this is that the surgery itself will cause scar tissue formation, and this can promote a cycle of surgery, adhesions, surgery, and you go round and round. It is a short-term solution, and the problem will reoccur. 55% to 100% of women develop adhesions following pelvic surgery. So, that's quite a high incidence. As I said, I had endometrial ablation, which is where they basically burn away with like a thermal balloon, burn away the endometrial lining. As I say, this is not suitable if you then want to have children. And obviously the last resort, hysterectomy, which solves the problem once and for all, but obviously there's a lot of considerations with age and menopause and whether you want children and all sorts of factors. So if surgery isn't an option for you, there are some non-surgical treatments, obviously painkillers, hormone medication. So some women, particularly at the beginning stages or when they're younger, will find contraceptives may reduce or stop, menstruation and therefore kind of solve the issue temporarily. Also, the intrauterine coils may make periods lighter, because it will basically stop the endometrial cells from forming so quick. You'll still get some form, but not like you would without the coil. But the issue with the coil is that it's not going to have any effect on other endometrial deposits, on the ovaries or the bowel or wherever it may be. Now you've also got holistic treatment options. So, and this is where the massage would come in. Certainly aromatherapy can have an analgesic effect, anti-inflammatory properties, and you can use this, in massage or in the bath, or even just as a, abdominal or back compress, if you've got pain there. Do see, a qualified aromatherapist if you're going to go and have a treatment. But one thing you can try is if you mix 10 mils of a base oil, so something like olive oil, mix that with 1 drop of ginger essential oil, which is pain relieving and warming, and it will really boost the circulation. 2 drops of grapefruit essential oil, which is a mild diuretic, eases swelling and fatigue. It's also antispasmodic, so can help relieve cramps. 1 drop of bergamot, which will improve mood, calm the mind, and also aid digestion. And 1 drop of clary sage, juniper, or cypress if you're in the week of your period. And these will be antispasmodic and encourage normal menstrual flow. So hopefully will help ease heavy flow, soothe cramps and stress. Massage, obviously, That's why I'm here. Gently breaks down adhesions and scar tissue through frictions. Lymphatic drainage methods can flush, stagnant fluids and toxins, help build, reduce built up sort of fluid retention, distribute proteins and vitamins throughout the tissues. While your petrissage techniques will help improve blood flow and nutrition into the muscles, but you need to see someone who is qualified and who is experienced in dealing with endometriosis. And another holistic remedy would be something like acupressure or acupuncture, working on those points relating to the reproductive system, to try and help remove any blockages that are restricting the circulation and help break down scar tissue and those internal adhesions. And then, finally you have your home remedies. So heat, heat packs, hot water bottles may help relieve pain from pelvic muscle cramps. And again, you can combine that with aromatherapy and have like a warm compress. Pelvic massage, ideally just before your period begins, may help reduce menstrual pain. But, as anyone with endometriosis knows, trying to identify when your periods are is not always that easy. Anti-inflammatories, so things like your ibuprofen. Turmeric can also act as an anti-inflammatory and can inhibit the estradiol hormone, hence reduce endometrial growths. And you can have this in your diet or in a capsule form. Dietary changes, reducing those inflammatory foods such as dairy, sugar, red meat, gluten, processed foods, and increasing things like your fruit and your veg and your whole grains and your omega-3 fatty acids, which will help reduce inflammation. Regular light exercise, helping to release those endorphins, which can help reduce pain and estrogen levels, and improve your mood. And rest, particularly when you're bleeding and in pain, lying on the side with your knees pulled into your chest may relieve the pain and the pressure in the back. So in terms of massage, how will massage help with your endometriosis? Okay, so the aim of massage is, to relax the nervous system, improve blood and lymph flow, reduce smooth muscle holding patterns without pulling those adhesions apart, in order to help, even those women who have scar tissue, that's formed as a result of surgery. Or those who are in the later stages of endometriosis, whose organs may now be stuck together. The bonds that attach collagen fibres to each other reduce when placed under sustained pressure over time. And so massage can therefore help reduce these adhesions, decrease the pain, and improve soft tissue mobility. And it does this without that risk that you get with surgery, of kind of forming new scar tissue. And since ablation and adhesiolisis are generally not permanent solutions, hysterectomy is a last resort. So massage is actually becoming, a non-aggressive treatment for treating the symptoms and potentially, delaying that need for surgery, thus improving the quality of life, not only in terms of physical health, But in terms of mental health and independence, social interactions, being able to go out, being able to get back to work, being able to, look after your family. And these things can really help just, boost your self-esteem, which can really take quite a battering when you have any kind of chronic condition. So the benefits of massage, with regards to endometriosis, it can help reduce those uterine spasms and pelvic pain, reduce adhesions. It can help to increase fertility, and we by reducing those adhesions, we know that infertility is often in these cases due to internal adhesions and dysfunction in the reproductive organs. Massage can also help reduce pain during sex, and research shows that 50% of women experience a full resolution of dyspareunia after 12 months. Improved sexual function, in terms of orgasmic potential, desire, arousal, lubrication, satisfaction, all these things can be improved. Improved lymph and blood circulation, transporting those nutrients and oxygen to the affected tissues, helping to heal the body. Massage relaxes the nervous system, and we know the effect on the hormones. It reduces the production of cortisol and norepinephrine, which are those stress hormones, and it increases the serotonin and the dopamine and oxytocin, which are those mood enhancing endorphins that also help reduce pain. They're also neurotransmitters, so they, that's how they help reduce pain. Massage will also help to ease any pelvic congestion, during any flare-up of endometriosis symptoms. The lower back muscles may go into protective spasms, which then increase the abdominal and pelvic tension. And so manipulation of these soft tissues can really help reduce, these spasms, and therefore, reduce overall pain. So, quite a few benefits, but you do need a therapist who understands this condition and is experienced in dealing with this condition. So what are the best types of massage for endometriosis? Certainly Swedish, will promote overall relaxation, help to improve the circulation, alleviate muscle tension, and improve the body's range of movement. But, if you're able to take a slightly firmer massage, having myofascial release, which is a massage form that involves stretching to work on the connective tissue that surrounds the organs and the muscles, breaking down scar tissue and those adhesions that form internally. Neuromuscular massage, having a deep tissue massage which releases tension in trigger points, can also help reduce pain and work on, those referred pain patterns. And now there is also something called fertility abdominal acupressure, which is where the abdomen is manipulated in a way that detoxifies the system and improves blood flow to the organs, thus improving the lining of the uterus, and it can also help relieve painful periods and painful sex. Now research shows, that massage is most effective for endometriosis when carried out as one session between period and ovulation, which again, it can be difficult to judge exactly when that is. But one session between period and ovulation, and 2 sessions between ovulation and the next menstrual cycle. and to continue this pattern for 3 months. Now, it may take up to around 2 weeks after treatment for the body and pain levels to start to adjust, but the benefits should really be seen after certainly sort of 6 weeks. Massage is a safe way to treat endometriosis, without causing, more scar tissue formation, without, negatively affecting your ability to conceive. But as I always say, it is so important to find a massage therapist who understands the condition and has experience in this area. But if you do that, then, hopefully you will see, some benefit. And it will at least help you manage your symptoms and just have, a better quality of life. But do subscribe to my channel for other videos related to women's health. Feel free to comment down below with any questions. Contact me through Facebook or Instagram. I will do my best to answer any questions you have. Just take care of yourselves, and I will see you next time. Okay, bye.